We typically walk our dog, but with the lower back recently, it's just been kind of hard.
Can you show me where you feel it at?
It's typically right down in
Down
here.
in the tailbone area.
Yeah.
There's the rest. Okay. There it is. Hey, yo. First things first, I know the lower back, that is like the biggest issue, correct?
Mm-hmm.
When did that start again? You tell me how.
As far as I know, it happened probably when I fell and broke my wrist.
Okay.
Because when I fell and broke my wrist, it was slipping on some mud.
Mm-hmm.
And when I twisted,
Okay.
I landed on this side and broke the wrist.
And that was how long ago again?
That was what, 2 years ago?
The chances are, based on your x-rays, it does kind of coincide with that much stress. Because usually if it's like you got the spondies in the front, so you're not just one, but you have two, right?
Mm-hmm.
So one is significant, but
Mm-hmm.
two is definitely a stress on the spine. And so when you do land on that, so you just landed on your hip and then you landed on your wrist.
The wrist broke the fall,
Uh-huh.
but I mean, it was just it was
Pretty
just
traumatic.
Yeah.
Okay. What happens is, and spondylolisthesis is basically where that bone on the top of it has slipped forward.
Mm-hmm.
Now you have two of them, but some people will do it from like heavy lifting, like squats and stuff like that, and they do a lot of weight. When they try to pull up, it's just so much stress and just pushes forward.
Okay.
Some people will hear like a popping noise and stuff like that. But if you have a fall like that, definitely it's enough to cause that thing to
Yep.
shift. Okay, that was 3 years ago, you said?
I think it was about 3 years ago.
Okay, yeah, the disc, you still have a little bit of disc space in there, so it does show me that it's not like recent, but it definitely it's within like the last 10 years is what we're looking at. Your neck, that's been going on for how long?
Since, when it really came to a head was in 2006.
Okay.
When it started really getting to the point where I was,
Two bulging discs.
yeah.
Yeah.
So,
Okay, so that does make sense with your x-rays because those discs are not as young.
Yeah.
They definitely have some more wear on it. The thing that sucks is a lot of times when you go into your medical doctor, a lot of times they'll just say, oh, it happens with age, arthritis, and all that stuff. But then you look at the other discs and those ones look great. It's like, well, why is this one? And so it tells us there's an injury, there's a trauma. So it's not about how old you are, it's more of like how long the problem's been there.
Right.
So 2006 to now, I mean, you definitely had some progression in there. So just kind of looking first glance here is basically you're going to see this left side, it's sticking out just a little bit more. So you do have some rotation happening in here. The interesting is, so it's sticking out a little bit more on the left. This hip is a little bit more elevated on the right. And so the interesting thing is your leg is shorter on the right, so it actually causes your hip to drop on the x-ray. But when you're sitting, it actually is pushing up like that.
Okay.
Now when you feel the lower back, can you show me where you feel it at?
It's typically right down in
Down in
here.
the tailbone area.
Yeah.
Okay. So let's go and get you scanned here. So we're going to scan you with this thing every single time you come into the office.
Okay.
It's going to help us to know where that inflammation's at and then what's going on. Yeah, so right in the area, I believe it was C5, C6, I
Yep.
think was the disc bulge, right?
Right.
We definitely got some pressure down below. We got some pressure here, and then we have some pressure up into this area as well. When I push into the spine, if you feel any pain, soreness, or tenderness, let me know right away.
Okay.
So right on over here. And then two. I'm going to go over to the right side. And then the left side. That's where it's stuck right there. So I say L6. Usually most people have 5 lumbars. You actually have a 6th lumbar.
Yeah.
And so in this situation, we're going to start with the sacrum, which is on the bottom here. It's posterior on the left based on the x-ray, what we're seeing here. And as well as when I push on that, it's really stuck. So this side moves really well. You got some gliding of that joint here. But that sacrum on the left attaching to the ilium, that's where it's really stuck there. So we're going to start with that sacrum on the left, and hopefully as we start to progress in that area, we'll never be able to fully correct or address those spondies or the spondylolisthesis, but we can try to add stability to it and try to keep you more functional and get that function in your lower back happening. Okay. Here's 4, 5, and then 6. Any soreness on 5?
It just feels like pressure.
And then 6. Some more pressure on 5. Okay. Okay, so you have a stepping effect in the cervical spine. So the L5, it does have a bone spur starting to develop and pushing back towards that spinal cord. L6 is the one where it actually starts that process. So you have L6 drops, and then L5 goes further, okay?
Mm-hmm.
So usually when there's a joint that's stuck, the joint above it overcompensates, and because of the hypermobility, the bone spur will start to develop, because think of it like if I'm standing here, I'm pretty solid. If there's like a earthquake or I'm on a boat and it's really wavy, I want to get a wider stance to stabilize it. The body will do the same thing and develop bone and create bone spurs to try to create that stability for you, okay? So the way we're gonna do is, usually we do this type of adjustment in the chair, but for you, we're gonna do this laying face down, because I wanna make sure that I get that joint moving forward. I don't wanna put as much rotation in there. It's gonna actually be more just going straight down, okay? So we're gonna start with your lower back, we'll do your mid back, and then we'll end with that neck here, okay? All right, a little bit more pressure here. There you go, relax that shoulder. Real tight there. You okay there? All right, we got one more. Oh, there it goes.
I heard that correct.
We got one more. And there's the rest. Okay. Let it go. Relaxing the shoulder. One more time, breathing in. Let it go. Relax that shoulder. There it goes. Good job. Now, what will happen, I'm going to squish your face a little bit, okay? But it's because I do it because I care. All right, breathing in. Letting it go. Relaxing the shoulders. Going to a little bit of a push right in here. You okay with that? And a little bit more. Breathing in. Let it go. And just relax these shoulders down. There it is.
Feels good.
Okay, good.
Feels good.
When you say you felt your neck, what does that mean?
I just felt that crack.
Okay.
Yeah, yeah. And at first it kind of, there was a little bit of
A zap.
A zap, yeah.
Yeah, when there's a lot of swelling, inflammation in those areas, it can be a little sore in the beginning. But as time goes on, those joints start to get more movement, and that inflammation should start to subside. But then also in terms of the mobility, it should start to get a lot better as well. Okay. A couple things. The first is you may feel some soreness, right? It's been this way for who knows how long.
Yeah.
2006
It's true.
potentially.
And I'm sore all the time. So.
Okay. So as we shift and move some things, your body is going to respond to that, and it can have a little bit of soreness. Ice is your best friend. The second thing is walking is the best form of exercise. Do you have any form of exercise routine right now?
We typically walk our dogs.
Okay.
But with the lower back recently, it's just been kind of hard.
Okay.
So
Go as far as and as much as you're able to. If it's 5 minutes, do 5 minutes. If it's 10 minutes, 10 minutes. But you want to get some movement into the joints, okay? It's going to undo the years and years of stress as your body goes through the motion.
Okay.
Okay. Other than that, any other questions from you?
I think that's pretty much it.
All right.
Thank
Well,
you.
All right, I'm excited
Thank
for
you.
you.
Me
We'll do
too.
some good things
I'm
for
really
you.
excited.